Seniors, stop what you're doing and listen to me right now. Your legs are trying to tell you something critical about your heart, and if you ignore these warning signs for even another week, you could be setting yourself up for sudden heart failure, that swelling in your ankles you've been dismissing as just water retention, the leg cramps that wake you up at 3 a.m., the strange skin changes you thought were just aging. These aren't random symptoms. They're urgent distress signals that your heart is struggling to pump blood effectively, and your body is literally crying out for help. But here's what terrifies me as a cardiologist. Most seniors have no idea their legs can predict a heart attack weeks or even months before it happens. They ignore the signs until it's too late, until they're in an ambulance wondering why they didn't pay attention sooner. What if I told you that by the end of this video, you'll know exactly how to read the 7 warning signs your legs are showing you right now, and more importantly, what if I showed you that catching these signs early could be the difference between living independently for another 20 years or becoming dependent on medications and hospital visits? Stay with me, because sign number 4 is so commonly ignored that I've seen it in nearly every heart failure patient who comes to my office too late. And the worst part? It's the easiest one to spot if you just know what to look for. If you're over 60 and experiencing any of these symptoms, pay very close attention. Swelling in your ankles or feet that gets worse as the day goes on, especially after you've been sitting or standing for a while. Unexplained weight gain of 2 to 3 pounds in just a few days, even though you're eating the same amount of food. Legs that feel heavy, weak, or exhausted, even after minimal activity like walking to your mailbox. A persistent cough or wheezing that seems to get worse when you lie down at night. Sudden difficulty catching your breath during activities that used to be easy for you. Do not dismiss these as normal aging. Do not wait another day to take them seriously. These are classic signs that your heart's pumping capacity is declining, and when your heart can't pump efficiently, fluid backs up into your lungs and lower extremities. This is called congestive heart failure, and it's one of the leading causes of hospitalization and death in seniors over 65. I'm Dr. Michael Carter, a board-certified cardiologist with over 23 years of clinical experience. I've treated thousands of heart failure patients, and I can tell you without hesitation that the seniors who survive and thrive are the ones who caught the warning signs early, specifically the signs showing up in their legs. Today, I'm walking you through the 7 leg-related symptoms that indicate your heart is failing. Some of these will shock you because they seem completely unrelated to your heart. But by the time we're done, you'll understand exactly why your legs are often the first place heart problems become visible. And here's what most cardiologists won't tell you in a standard 15-minute appointment. There's a specific order these symptoms tend to appear in, and knowing that sequence can help you determine how urgently you need medical intervention. Before we dive into the 7 signs, I need you to do something important right now. Type just one number in the comments. 1 if you have swollen ankles, 2 if you experience leg cramps at night, 3 if you've noticed skin changes on your legs. I want to see which warning sign is affecting the most seniors watching this video. This data helps me create future content that addresses your most urgent concerns, and it helps other viewers realize they're not alone in what they're experiencing. Pause for just 3 seconds and type that number. I read every single comment. Now, let's talk about what's really happening inside your body when your heart starts to fail. Your heart is a pump. That's it. It's a muscular pump designed to push blood throughout your entire circulatory system, about 2,000 gallons of blood every single day. When you're young and healthy, your heart does this effortlessly. But as we age, especially after 60, several things start to happen. First, the heart muscle itself can become weaker due to years of high blood pressure, previous heart attacks, or chronic inflammation from conditions like diabetes. Second, the heart valves can become stiff or leaky, meaning blood doesn't flow in one smooth direction. Some of it sloshes backward with each heartbeat. Third, the electrical system that coordinates your heartbeat can become irregular, causing inefficient pumping rhythms. When any of these problems develop, your heart loses its ability to pump blood forward effectively. And here's the critical connection to your legs. Your legs are the farthest point from your heart. Blood has to travel all the way down your body, deliver oxygen and nutrients to your leg muscles and tissues, and then fight against gravity to travel all the way back up to your heart. When your heart is strong, this happens smoothly, but when your heart starts to weaken, it can't generate enough pressure to pull that blood back up efficiently. So what happens? Blood begins to pool in your legs. Fluid leaks out of your blood vessels into the surrounding tissue. Oxygen delivery decreases. Waste products accumulate. This is why your legs are often the first place you'll see evidence of heart failure. They're the canary in the coal mine, warning you that your heart is struggling long before you feel chest pain or shortness of breath. Now let's go through the 7 specific signs, and I want you to mentally check off which ones you're experiencing right now. Sign number 7. Persistent swelling in your ankles and feet. This is the most common sign, and unfortunately, it's the one most people ignore the longest. When your heart can't pump effectively, pressure builds up in the veins that carry blood back from your legs. This increased pressure forces fluid out of your blood vessels and into the surrounding tissue, particularly around your ankles and the tops of your feet. Here's how to test if you have true edema. Press your thumb firmly into the skin above your ankle bone for 5 seconds. Then release. If you see a dent that stays visible for more than a few seconds, that's called pitting edema, and it's a red flag. Normal swelling from standing all day goes away quickly when you elevate your legs. Heart failure edema does not go away easily, and it tends to get progressively worse as the day goes on. If you notice your shoes feel tight by evening, or you can't see your ankle bones anymore, your heart may be sending you an urgent message. Persistent edema means your heart's pumping capacity has already declined by approximately 20–30%. This is not early-stage failure. This is moderate failure that needs medical attention now. Sign number 6. Unexplained leg cramps, especially at night. Many seniors assume leg cramps are caused by dehydration or low potassium. And while those can be factors, persistent nighttime leg cramps are often a sign of poor circulation caused by heart failure. Here's what's happening. When your heart can't pump blood efficiently during the day, your leg muscles don't get enough oxygen. By nighttime, they're exhausted and depleted. When you lie down, blood flow becomes even more sluggish, and your muscles rebel with painful cramps. These aren't mild Charlie horses. I'm talking about severe gripping cramps in your calves or feet that wake you up from deep sleep. You have to get out of bed, walk around, or massage your legs to get relief. If this is happening more than twice a week, and especially if it's getting progressively worse, your heart is struggling to deliver adequate oxygen to your extremities. This often appears 3 to 6 months before more obvious heart failure symptoms like severe shortness of breath. It's an early warning that gives you time to intervene before permanent heart damage occurs. Sign number 5. Cold feet and legs, even in warm environments. If your feet feel ice cold even when you're wearing warm socks in a heated room and your spouse's feet feel normal, pay attention. When your heart's pumping power declines, it prioritizes blood flow to your vital organs, your brain, kidneys, and the heart itself. Your extremities, especially your feet and lower legs, get whatever's left over. Reduced blood flow means less heat delivery. Your legs literally become colder because there isn't enough warm blood reaching them. Here's the test. Touch your shins with the palm of your hand, then touch your forearm. If your shins feel noticeably colder than your arm, that's abnormal peripheral circulation. But here's what makes this symptom particularly concerning. It often occurs alongside something called peripheral cyanosis, where your toes or feet take on a slight bluish tint, especially the nail beds. This blue color indicates severe oxygen deprivation. When your tissues don't get enough oxygen for extended periods, they begin to die. This is how diabetic foot ulcers develop and how heart failure patients end up with non-healing wounds that lead to infections and amputations. If you have consistently cold feet plus any bluish discoloration, you need a cardiovascular evaluation within 48 hours. This is not something you wait on. Sign number 4. Skin changes on your lower legs. Shiny, tight, or discolored skin. This is the sign I told you not to ignore, and here's why. It indicates that heart failure has progressed to the point where it's causing chronic venous insufficiency and tissue damage. When fluid has been accumulating in your legs for weeks or months, the skin begins to change in very specific ways. Your skin looks abnormally smooth and shiny, almost like it's been polished. This happens because chronic swelling stretches the skin so tightly that it loses its normal texture. When you touch it, it feels taut and stiff rather than soft and pliable. You might notice patches of reddish-brown or dark brown discoloration, typically starting around the ankles and spreading up toward the calves. This is called hemosiderin staining, and it happens when red blood cells leak out of weakened capillaries and break down in the tissue, leaving behind iron deposits. This staining is semi-permanent. Even if you improve your heart function, these dark patches often remain for months or years. In advanced cases, the skin and underlying tissue become hard and woody to the touch. This is because chronic inflammation has caused fibrosis, essentially scar tissue formation in your leg tissue. When I see this in a patient, I know their heart has been failing for at least 6 to 12 months, possibly longer. The most serious skin change is the development of open sores, typically around the ankle area. These ulcers are caused by severe oxygen deprivation and increased pressure in the veins. They're incredibly difficult to heal because the underlying circulation problem hasn't been addressed. I've seen seniors suffer with these wounds for years, trying every cream and bandage, never realizing the real problem was their heart, not their skin. Most people see skin changes and think diabetes or poor hygiene or old age. They never connect it to their heart. This is exactly why heart failure gets diagnosed so late in many seniors. If you have any of these skin changes, especially combined with swelling or cold feet, you need an echocardiogram and BNP blood test immediately to assess your heart function. These tests will show exactly how well your heart is pumping and whether you're in heart failure. I cannot stress this enough. Skin changes are not cosmetic issues. They're visible evidence of internal cardiovascular crisis. Sign number 3, difficulty walking short distances without leg fatigue. If you used to walk around the grocery store easily, but now your legs feel like lead weights after just one aisle, your heart is failing to supply adequate oxygen during physical activity. This is different from general tiredness or muscle weakness. This is a specific, heavy, weak, burning sensation in your leg muscles that forces you to stop and rest frequently. Here's the physiology. When you walk, your leg muscles demand more oxygen. Your heart is supposed to respond by pumping more blood, but when your heart is failing, it can't increase its output enough to meet the demand. Your leg muscles switch to anaerobic metabolism, burning energy without oxygen, which produces lactic acid. This causes that burning, fatigued feeling that makes you want to sit down immediately. Cardiologists use something called the 6-minute walk test to assess heart failure severity. If you can't walk continuously for 6 minutes, or if you cover less than 300 meters in 6 minutes, your heart function is significantly impaired. Try this test at home on a flat surface. If you have to stop multiple times or feel severely out of breath, schedule a cardiology appointment this week. Sign number 2, leg swelling. That's worse on one side than the other. This is a particularly dangerous sign because it can indicate 2 serious conditions. When heart failure slows blood flow in your legs, blood becomes sluggish and prone to clotting. If you develop a blood clot in one of the deep veins in your leg, that leg will swell more than the other. DVT is life-threatening because the clot can break free and travel to your lungs, causing a pulmonary embolism, a blockage that can kill you in minutes. Warning signs of DVT: one leg significantly more swollen than the other, warmth or redness in the swollen leg, pain or tenderness in the calf or thigh, swelling that develops suddenly over 24-48 hours. If you have these symptoms, go to the emergency room immediately. Do not wait. Do not see how it feels tomorrow. Sometimes heart failure affects the right side of the heart more than the left, causing more pronounced swelling on one side of the body. This requires specific treatment targeting right-sided heart function. The key point: symmetric swelling in both legs equally suggests general heart failure. Asymmetric swelling where one leg is much worse suggests either a clot or right-sided heart failure, both of which need urgent evaluation. Sign number 1, restless leg syndrome. That's getting progressively worse. This is the most overlooked sign on this entire list, and it's often the earliest warning. Restless leg syndrome causes uncomfortable sensations in your legs, tingling, crawling, aching, that create an irresistible urge to move them, especially at night. While it has multiple causes, worsening restless legs in seniors over 60 is frequently linked to poor circulation from declining heart function. Here's the connection. As your heart fails, blood flow to your leg nerves becomes inadequate. These nerves become irritated and start sending abnormal signals to your brain, creating those uncomfortable sensations. What makes this particularly significant is the timing. Restless leg syndrome from heart failure typically gets worse when you lie down at night. Why? Because lying flat redistributes fluid from your legs back toward your lungs and heart, suddenly overwhelming your already struggling heart. Your body responds by creating uncomfortable leg sensations that force you to get up and move around. It's actually a protective mechanism. Walking helps pump blood out of your legs and reduces the load on your heart. If your restless legs are getting progressively worse over weeks or months, and especially if they're accompanied by any other sign on this list, your heart function needs to be evaluated immediately. Many seniors get prescribed medications for restless legs without anyone checking their heart. The medication might temporarily mask the symptom, but the underlying heart failure continues to worsen silently. Now that you know the 7 signs, let's talk about what you need to do if you're experiencing any of them. Step 1. Document your symptoms. Starting today, keep a daily log. Rate your leg swelling on a scale of 1 to 10 each evening. Note any leg cramps, when they occur, and how long they last. Record your weight every morning. Weight gain of 2 to 3 pounds in 2 to 3 days is a red flag. Track how far you can walk before leg fatigue forces you to stop. This documentation is invaluable when you see your doctor. It shows patterns that a single office visit might miss. Step 2. Get these 3 tests. Don't just tell your doctor about your symptoms and accept that it's probably just aging. Insist on these specific tests. An echocardiogram shows exactly how well your heart is pumping. The key number is your ejection fraction, the percentage of blood your heart pumps out with each beat. Normal is 55-70%. Below 40% indicates significant heart failure. A BNP or NT-proBNP blood test measures a hormone your heart releases when it's under stress. Elevated levels confirm heart failure even before symptoms become severe. A Doppler ultrasound of leg veins checks for blood clots and evaluates how well blood is flowing back from your legs to your heart. If your doctor dismisses your concerns without ordering these tests, find a different doctor. Your life may depend on it. Step 3. Immediate lifestyle modifications. While you're waiting for test results, start these interventions today. Reduce sodium to under 1,500 milliliters daily. Salt causes fluid retention, which puts additional strain on your failing heart. Read every label. Avoid processed foods, canned soups, deli meats, and restaurant meals. Elevate your legs 3 times daily. Lie down and prop your legs up on pillows so your feet are higher than your heart. Do this for 20 minutes, 3 times a day. This helps drain accumulated fluid. Wear compression stockings. Medical-grade compression stockings help push blood back up from your legs. Put them on first thing in the morning before swelling starts. Monitor your fluid intake. In heart failure, drinking too much fluid can worsen swelling. Limit total fluids to 1.52 liters per day unless your doctor advises otherwise. Weigh yourself daily. Same time every morning after using the bathroom, before eating. If you gain 2 to 3 pounds in 2 to 3 days, call your doctor immediately. This indicates fluid accumulation and worsening heart failure. Now let me warn you about dangerous mistakes seniors make when they notice these leg symptoms. Mistake 1. Assuming it's just venous insufficiency. Yes, vein problems can cause leg swelling, but in seniors over 60, heart failure is a much more common and dangerous cause. Don't let a diagnosis of bad veins stop you from getting your heart checked. Mistake 2. Taking diuretics without medical supervision. Some seniors start taking over-the-counter water pills when they notice swelling. This is extremely dangerous. Diuretics can cause severe electrolyte imbalances, kidney damage, and dangerous drops in blood pressure if not properly monitored. If you need diuretics, they should be prescribed and monitored by a physician who's tracking your kidney function and potassium levels. Mistake 3. Ignoring symptoms because your chest doesn't hurt. Heart failure is not the same as a heart attack. You don't need chest pain to have heart failure. In fact, many heart failure patients never experience chest pain. Their only symptoms are in their legs and lungs. Mistake 4. Waiting for symptoms to get bad enough. Heart failure is progressive. It doesn't get better on its own. It only gets worse. The longer you wait, the more permanent damage occurs to your heart muscle. Early intervention can often reverse heart failure, or at least stabilize it. Late intervention often means you're managing irreversible damage for the rest of your life. Let me give you the complete summary to screenshot and save. 7 signs in your legs that mean your heart is failing. Number 7, persistent ankle and feet swelling. Number 6, unexplained leg cramps, especially at night. Number 5, cold feet and legs even in warm environments. Number 4, skin changes, shiny, tight, discolored, or hardened skin. Don't ignore this. Number 3, difficulty walking short distances without leg fatigue. Number 2, leg swelling worse on one side. Possible DVT. Go to ER. Number 1, Worsening restless leg syndrome. Document symptoms daily including swelling, weight, and walking distance. Get echocardiogram, BNP blood test, and leg Doppler ultrasound. Reduce sodium to under 1,500 mg daily. Elevate legs 3 times daily for 20 minutes. Wear medical-grade compression stockings. Weigh yourself every morning. Call doctor if you gain 2 to 3 pounds in 2 to 3 days. Emergency warning signs. Go to ER immediately. One leg suddenly much more swollen than the other. Severe shortness of breath when lying down. Chest pain or pressure. Coughing up pink, frothy mucus. Sudden confusion or extreme fatigue. If there's one message I want burned into your mind after watching this video, it's this. Your legs are not separate from your heart. They're connected by the same circulatory system, and they often show you what's happening in your heart weeks or months before you feel it in your chest. Here's my challenge to you. Tonight, before you go to bed, examine your legs carefully. Look at the skin color and texture. Press your thumb into your ankle and see if it leaves a dent. Feel the temperature of your feet compared to your arms. Notice if one leg looks different than the other. Then, over the next 7 days, check your legs every evening and track any changes. If you notice even 2 of the 7 signs I described today, schedule an appointment with a cardiologist this week, not next month, this week. Then, come back to this video and answer these questions in the comments. Which of the 7 signs are you experiencing right now? How long have you been ignoring these symptoms? When is your cardiology appointment scheduled? Your comment could save someone else's life. When other seniors see that people are taking action, it motivates them to do the same. And here's something important. If you're watching this video and thinking this might be my mom or this sounds like my husband, please share this video with them immediately. Heart failure is one of the most preventable causes of death in seniors, but only if it's caught early. The seniors who survive are the ones whose family members paid attention and insisted they get help. Subscribe to my channel for more life-saving cardiovascular health information designed specifically for seniors over 60. I'm Dr. Michael Carter, and my mission is to help you recognize the warning signs your body is sending you before it's too late. Your body is always talking to you. The question is, are you listening? Your legs have been trying to tell you about your heart. Now you know the language. Now you can respond. Don't ignore what your body is showing you. Don't wait until you're in the emergency room wondering why you didn't act sooner. Check your legs tonight. Document what you find. Get the tests you need, and give your heart the medical attention it's asking for. Your life and your independence depend on it. Take care of that heart, and I'll see you in the next video.